Hi, Dr. Yass here. Lately, I've been doing a lot of guest appearances on podcasts, and I'm trying to present to the audience the chasm between the Yass method and the existing global medical establishment use of MRIs or X rays to identify the cause of pain versus the Yass method of interpreting the body's presentation of symptoms to identify the tissue in distress, creating those very symptoms, that there is, in fact, a connection between a tissue in distress and the symptoms the individual experiences, that those symptoms are, in fact, part of the feedback mechanism of the body that are elicited by a tissue when it's not working properly and it's trying to create awareness to the individual that it's not working properly, so it elicits very specific symptoms. And the idea is that an individual who is in a position to diagnose and treat that individual should interpret the symptoms to know what tissue is creating them and therefore provide the appropriate intervention to resolve the, the tissue, the distress of the tissue, thereby ending its need to elicit the symptoms. So we have two sides here. We have the blind acceptance of whatever an MRI or X-ray identifies. It's an identification of some structural abnormality on an image versus the interpretation of symptoms that the body is presenting to create awareness of a tissue that's not working, and those symptoms are being elicited by that tissue. And in identifying the tissue, you could then resolve the distress of the tissue. So those are the two diagnostic mechanisms you have to choose from. So I kind of recently started saying stuff like there are principles of a system, and then there are principles of the body, the way the body works. And I am trying to convey to people that the use of the MRI, although sounding highly scientific, and doctors will tell you it's based on their education and training, those are principles of a system. The theoretical basis of the connection between a tissue in distress and the symptoms it elicits and the interpretation of those symptoms to identify the tissue in distress are principles of the body. And I jokingly have been saying, shit, man, just go back to Hippocrates himself, the father of medicine, the guy who basically created the basis of the way medicine is supposed to be run today. And I guarantee you, he discussed the concept of symptoms as a way of interpreting what needs to be addressed. So I just, for the hell of it, decided to Google Hippocrates and symptoms. And so I got this study that was done, which isn't really so much a study, it's more a position paper. And it's called Healthcare Practices in Ancient Greece, the Hippocratic Ideal. And it goes on to discuss the, the three-pronged approach of Hippocrates, which related to mental health, physical health, and the other aspects of and then determination of disease, and how he wanted to achieve these things. So at one point it describes this: Hippocratic medicine is the belief that medicine should be practiced as a scientific discipline based on the natural sciences, diagnosing and preventing disease as well as treating them. Also, Hippocrates believed that the physician should study anatomy, in particular that of the spine and its relationship to the nervous system, which controls all functions of the body. In addition, he was the first who believed that this observation helps recognize the symptoms of each disease. Hippocrates is saying that in observing the way the nervous system, and the spine, at that time, that's what he was focused on, appear and are functioning, will help to understand the symptoms, to recognize the symptoms of each disease. Hippocrates himself was recognizing that a physical observation, a physical examination is required to interpret the symptoms being presented in that examination to identify the disease that would be creating those symptoms. So then it goes to another part, and then it discusses this idea that specifically in their diagnoses of syndromes or diseases, Greek physicians were instructed to note the geological location, climate, age, gender, severity of pain, chills, coughing, sneezing, belching, flatulence, convulsions, nosebleeds, even menstrual changes were recorded. So they're doing this thorough physical evaluation of the individual. This is Greek times. No x-rays, no MRIs. All they got is their brain and their intuition to determine what is the disease that that person may have, creating these symptoms that they're reviewing. The physical evaluation required great attention to be given to fever, respiration, paralysis, and color of limbs, pain on palpation, stool, urine, sputum, and vomit. The overall assessment of these recordings interpreted the final diagnosis and determined the type of treatment of the disease. Again, reasserting the idea that the physical evaluation is the key to understanding what tissue is in distress or what disease was creating those symptoms. Here's the home run. Moreover, the author mentions that the key area of Hippocratic medicine was the precision of the details of prognosis and the reliability of prognostic signs. What are prognostic signs? The symptoms. The symptoms determine the prognosis. How well they're going to do. What is the recognition of what's happening in the body to understand what may be causing it? According to a recent Greek review, the Hippocratic physician had to examine a patient, observe symptoms carefully, make a diagnosis, and then treat the patient. I'll give you that one again. According to recent Greek review, the Hippocratic physician had to examine a patient, observe symptoms carefully, and make a diagnosis, and then treat the patient. So, what can you glean from a historical review of the way the Hippocratic doctor was required to address his patients? Clearly, based on that information, a history was taken and it's described somewhere, but most importantly, the number one mechanism for determining the cause of the symptoms being experienced or the disease entity that could be identified was through a physical evaluation, interpreting the symptoms the individual described. That's Hippocrates. That's Hippocrates. That is the supposed method that's continuing to be used today. You, as a patient, have been involved in the medical system for months, years, or whatever. Do you agree that the interpretation of symptoms, of physical examination, is the primary mechanism by which the cause of your pain is being identified? If you say yes, God bless, babe. That's awesome. But if you say no, that if you go to a doctor, any doctor, they're going to say, here's a prescription for an MRI, come back, we will discuss discuss and review the results of the MRI. That sounds more like what I hear globally from pretty much anybody who's seeking an answer to the cause of their pain. Now, conversely, look at the Yass method. You get a Yass method Zoom session. The beginning of the session is you talking. I'm going to ask about the history of the symptoms. I'm going to do a complete physical evaluation, not just where your pain is. If you have pain in your knee, I don't put my eye to your knee and say, well, if the pain's at the knee, the cause is at the knee. That's a classic medical failure. I have shown that in more than 99.9% of cases, the cause of pain is not where the symptom is being experienced, because I take an overall view of the body as Hippocrates describes. I look at your overall physical examination, where the symptoms are. And when you say symptoms, it's not necessarily where the pain is. Is the individual having an altered functional capacity? Do they limp? Can they go up and down the stairs? Can they kneel? Can they do the things that they want? Those are symptoms. I look at is there altered posture? If there's altered posture, then clearly the body is not in balance. How does someone not accept that as reality and a component of understanding why the person's having pain? They even talked about, Hippocrates himself talked about palpation. I asked the person to point to where their pain is. That's critical. That's critical. Where does the pain begin? Where does the pain end? These are critical components. It's all part of an overview of the individual. An interpretation of the body's presentation of symptoms to identify what tissues in distress eliciting the symptoms being experienced. Hippocrates himself, if he was here today, would be on my side. He'd be endorsing the Yass method, because I'm following the practices that are based on his beliefs about how the body should be treated, diagnosed and treated. The medical system has walked away from it completely. They have abandoned the Hippocratic concept of how to diagnose and treat, and have gone to a singular concept, diagnostic tests. It is a complete failure. Everybody acknowledges that, but if you want to know why, just look to history. Go back and understand what Hippocrates believed and how he thought that the body should be diagnosed and treated. Now look at the two opposing opportunities. Globally, diagnostic testing as the absolute gold standard, no other mechanisms incorporated to address a diagnosis. The Yass method, a full evaluation of the body to interpret the body's presentation of symptoms, to understand what tissues in distress creating that symptom. In more than 98% of cases, it's muscle, which makes it very easy to resolve through the targeting of the individual muscles that are responsible for the symptom and causing them to adapt to greater and greater resistances until their force output is greater than the force requirement of your activities, which leaves you pain-free and fully functional. I'm excited. I'm excited, and I feel invigorated to know that if you go back and do a literature search on Hippocrates, the man that is considered to be the father of modern day medicine, that I, through the Yass method, are following his principles, where the medical system has 100% abandoned them, gives me comfort in saying that over time, most everybody will see that this method, the Yass method, is the right method for getting the right diagnosis and the right treatment. If you are starting to be swayed towards investigating the Yass method or getting a Yass method Zoom session, you can contact me by email at drmitch@mitchellyass.com. If you'd like to go on my website and schedule a session, now you're sure that this makes more sense, then you can go to my website, livewithoutpains.com/sessions, livewithoutpains.com/sessions. I'll have both of those in the description. If you like this video, please give it a thumbs up. If you like my YouTube channel, please subscribe to get notifications when new videos are added. Ladies and gentlemen, I'm trying to give you all the information you need to make a good, informed decision why you should switch from a failed system that has left you in pain for months or years and go go to something that is completely outside the system, has nothing to do with the system, and actually uses the basis created by Hippocrates himself to diagnose and treat your symptoms. Please consider it, take action. For now, this is Dr. Mitchell Yass wishing you a pain free, fully functional life. Bye bye for now.